Let's talk from somebody that is metabolically unhealthy right now. They want to make diet and lifestyle changes to work their way back. What's the beginning look like for them? And we've already talked about the low carb, the keto, the carnivore. We know diet's a big piece of this. Let's start there and talk about how somebody would work their way back.
Yeah, so it really depends on what they're eating right now. And again, this is why I wouldn't say we can't recommend just one diet. You got to recommend a diet that's going to work with someone. But any movement towards predominantly whole foods and lower carb is going to be the right move, right? So that's where I really have a problem with someone with the dietary guidelines saying eat less red meat. Well, the studies about red meat that are involved, that are combined with high calorie, high carb, high sugar, metabolically unhealthy, that's very different from somebody eating a whole foods diet with red meat and vegetables, no ultra processed foods, and otherwise improving their metabolic health. Those are two completely different scenarios. So I just use that as an example that we can't make blanket statements about good food, bad foods, good diets, bad diets. It's the diet that's going to help you improve your metabolic health. For most people, that is going to be a whole foods, lower carb type diet. Now, again, the ultimate example of that is a ketogenic diet because that's a very low carbohydrate diet, but not everybody needs to do that. So, if your morning's going to look like, and I should also mention protein. We've also been sort of trained by dietitians in the, modern medicine that we actually don't need to eat that much protein, that this 0.8 grams per kilo is perfectly adequate. And that's what you need to prevent protein deficiencies, but that doesn't mean it's optimal for metabolic health and for body composition. And that's where you do want to make sure you're getting a good amount of protein, about 1.5 grams per kilogram for the average person. So, start your day. If someone starts their day with one egg and oatmeal, it's very different than if you're going to start your day with 4 eggs with some spinach and some cheese. 1, you're going to get more protein. 2, you're going to be much fuller. You're not going to get hungry as quickly, which is another vital component about a healthy diet. 3, your carbs are going to be lower. Your insulin spike's going to be much less, and it's going to get you further down the path towards metabolic health. Then chances are you're not going to be hungry again for at least till lunch. You're not going to snack in between. Whereas if you have, a bagel and banana and a bunch of fruit, you're probably going to be hungry a couple hours later and you're going to snack and your insulin's never going to have time to come down because you're snacking and you're eating, right? So that's going to not move you towards metabolic health as quickly. Then for lunch, you have a Cobb salad. Again, it's going to keep you pretty full because it's got plenty of protein, it's got the fat in there, and is relatively low carb. And then for dinner, you have salmon or chicken or steak or ground beef with a whole bunch of above ground vegetables and some avocado. And some people may be in ketosis with that kind of eating pattern. Some people may not. But that type of eating pattern is going to improve your metabolic health, especially if you find yourself being full, you're not snacking, you naturally reduce your calories. This is one of the most noteworthy things about low carb and ketogenic diet trials is if you compare it to a low fat diet and the low carb diet, and you just let them eat as much as they want, almost without fail, the low carb diet people are going to eat significantly fewer calories because they feel fuller. They're getting their protein, they're getting their nutrients, and that goes a long way, especially if they're high quality calories that are giving you your protein and your nutrients. So that goes a long way towards improving metabolic health. So moving in that direction, I think, is the first step. Now, if you want to get more detailed and work with a doctor or a dietitian or a coach or someone who can design your macros and design exactly, what you're eating when, and you can use your app, sure, you can do that. But the general concept is move in that direction and you're going to be healthier.
If somebody wants to do this in the most efficient way possible, I would assume going keto would be the way to go, unless you want to go carnivore. But what I'm getting at here is any reason somebody would want to go low carb versus keto? Or is it just for taste buds and for social situations? Why wouldn't we go keto if somebody's metabolically unhealthy to get them back?
Yeah. There's almost no reason why someone shouldn't go into ketosis. there's some rare medical conditions where you just can't metabolize the fat or utilize the fat well, but they're very rare. But yes, otherwise it is, enjoyment, logistically being able to do it, feeling deprived, being able to not feel like you're a social outcast. And none of those things have to be true with a ketogenic diet. But in our society, a lot of people do feel that way. And it's like too much of a step for some people, which is fine. Like, absolutely. You can see benefits by going low carb. So I think that's the key, and especially if, gosh, when, you read articles about keto being the worst diet and they're just so off base and your doctor says you can't eat all that fat, keto diets are terrible for you. People have this perception of, fat is bad and keto is bad. All right, in that case, let's, start you with low carb and maybe you can inch your way towards keto. But that's, those are other reasons why to not go into ketosis, but none of them are really good, sound, physiologic, medical reasons.
All right. For somebody going low carb, obviously they're going to bring their blood glucose down overall, bring insulin down overall. The other layer with ketosis is producing ketones in the body. Mm-hmm. Talk about specifically how you think of those and how they benefit metabolic health.
Yeah. So, it's so interesting to try and tease out what is a benefit from reduced insulin, from reduced calories, from reduced body fat, and from actually having ketones. So you can think of ketones as two ways. One, you could say they're just a byproduct, right? You're burning fat for energy and ketones are a byproduct and, so be it. Or the research actually shows that ketones are an active molecule. They have actual active benefits and they're not just a byproduct and innocent bystander. There's one study showing about the NLRP3 inflammasome. So ketones can actually directly decrease inflammation. There are some studies suggesting that ketones have an actual satiety benefit to make you feel fuller and not as hungry. Ketones themselves can be used for energy. They're, an active signaling molecule that can affect the genes themselves and the histone deacetylates. And then when we talk about the brain, that's where ketones really thrive because your body can use fatty acids for energy very efficiently. The brain does not use fatty acids as efficiently for energy, but can really efficiently use ketones. So if your muscles are using the fatty acids and not requiring as much glucose, you don't want your brain still using all that glucose, but the brain can use the ketones and reduce its use on glucose. Now, it's not 100%. Even some of the early starvation studies suggest maybe 70% ketones, 30% glucose. That's still a pretty dramatic effect, especially if the brain is suffering from insulin resistance or poor energy utilization of that glucose. So allowing the brain to use ketones is so effective, and it's been shown for over a century and then for decades with clinical research that it can reduce seizures, especially refractory seizures that your kids are taking medications and not seeing benefit, but then ketosis can reduce or even eliminate seizure frequency in a number of these individuals. And now we're seeing it with mental health as well, with bipolar disorder, schizophrenia, depression, possibly even anxiety, OCD, PTSD, that they can see dramatic improvements with ketosis, a lot likely having to do with the brain energy. And the same with cognitive dysfunction, Alzheimer's disease, even maybe Parkinson's disease. So it's really sort of cutting edge research now that we're learning so much more about the benefits of ketones in the brain. And still, improving metabolic health can improve all those things, but metabolic health without the ketones in the brain doesn't seem to be as effective as with the ketones in the brain. So that's pretty exciting about ketones as a therapeutic potential.
Somebody that's gone low carb, not quite ready for keto, but they want some of these benefits from ketones. How do you feel about C8 MCT oil, exogenous ketones?
Yeah.
Say going low carb and then adding those as an adjunct to that diet.
Yeah. So the easy answer is we just need more research, right? We just need more research to know if that's going to be as effective as a ketogenic diet. But The other thing is it's something you can just test in yourself, right? So people can do this on their own to see if they get the benefits or not. Um, there's practically no harm to taking MCT oil, to taking exogenous ketones. There's the cost of it, and if you take too much, you might get nauseous or have some GI side effects or diarrhea or something. But you'll learn that pretty quickly and work your way up to it. But yeah, it's definitely worth doing. Like some people, I talk about the brain benefits from the perspective of like treating a brain ailment, but there are also people who just say, I think clearer. I have less brain fog. I can concentrate better. And there haven't been studies really looking at that, but there have been so many, individual reports and people's clinical practices where they see this over and over again. And people can see that from exogenous ketones as well. So I think there is room for a mix of it. Where I'm not so sure the exogenous ketones help is like just for, weight loss or for improving metabolic health. I mean, I really think you need the lifestyle and diet, sleep, exercise, etc. for that. But for brain-based benefits, I think that's where you could see more benefit from exogenous ketones.
The other piece of that I wonder about is how is that person's metabolism able to utilize that fuel if they haven't trained it? So they're a carb burner, sugar burner, and they're putting those in. Their body isn't used to those. Can they utilize them the same? Just a thought experiment.
Yeah, and it's fascinating, I think, from a evolutionary perspective. Like this is the one time in evolutionary history that we can have high glucose, glucose utilization and high ketones. Like when would that ever exist previously? It couldn't have. It just seems like physiologically impossible. So who knows what's going to happen?
The other tool that fits nicely into this part of the conversation is fasting. So intermittent fasting, longer fasts, obviously that's even more extreme than carnivore, bringing no food in and allowing the body to metabolically heal during that phase and also potentially produce ketones. So talk about how you feel about fasting.
Yeah, fasting can be a really powerful technique. But it's important to define, like, what are we talking about with fasting, right? For some people, not eating for 12 hours is considered fasting. And for some people, not eating for 5 days is considered fasting. So, time-restricted eating, not eating all day long, eating in a 8-hour window or a 6-hour window, I think can be really beneficial. Interestingly, the science is a little split, and a lot of it depends on the study structure. And this is a great example on how you can't just sort of use one study and extrapolate it to everyone. I remember there was one study looking at time-restricted eating versus not, and the people in the time-restricted eating window actually ate more calories. And they didn't see as many benefits. And okay, maybe that's not such a surprise. And they didn't really regulate the quality of food. So, I think if you're eating high carb, high calorie, high refined carb, processed foods, maybe it's not going to do a whole lot. But if you can use it as a tool in your otherwise healthy diet, and use it as a sustainable way to reduce your calories and give your body more time where nutrients aren't coming in and your insulin level can go low and stay low, there definitely can be benefits. Now, it's not for everybody. Absolutely no question. It's not for everybody. Some people do get sort of this rebound hunger, or just a psychological feeling that you need to eat more because you didn't eat for that period of time. I've got a number of people in my practice who I try time-restricted eating, and that's their response. And I just say, forget it. It's not for you. Not everybody needs to do it. What's interesting, though, is as people go low-carb or keto, a lot of people naturally tend towards that way. If you're used to breakfast at 7, snack at 10, lunch at noon, snack at 3, dinner at 6, all of a sudden, like, oh, wait, I haven't had my snack yet, and I just missed lunch, and I kind of didn't even think about it, and it's like revolutionary for them to think that way. Well, a lot of people experience that when they're in ketosis, and I think that's just, sort of a natural, healthy response, as long as you're getting enough protein, as long as you're getting enough nutrition. And so that's something to definitely pay attention to. Now, the longer fasting, the 3 to 5 day fasting, that also has a place. I guess from my personal standpoint, I think it's miserable. Like, I don't think it's any fun whatsoever. I hate doing it. So if I'm going to do that personally, I better be pretty confident I'm going to get some benefits out of it. But this is where the whole longevity field, sure, it can help with weight loss. Sure, it can help with metabolic health. I think there are better ways to do that. The main benefit I think for longer fasts like that is the potential for this longevity research, for stem cell regeneration, for reducing the size of organs. A lot of the surrogate type data that suggests it may be good for longevity. Again, not doing it very often though, because you're going to lose some muscle mass. You need to make sure you're getting adequate protein before and after. It can come with some negatives, but for some people, it can really be beneficial. I just don't think it's necessary for the majority of people. Now you look at someone like, Dr. Jason Fung, and he's developed like a whole clinic, a whole practice around extended fast to help people with their type 2 diabetes, to help people lose weight. And they've got a protocol that works. So for those people who really want to do it and it works for and are committed to it, by all means, I just don't think it's necessary for everybody.
So we're starting to stack up different tools, including going lower carb, fasting. We've talked about a whole bunch of different stuff. As to not overwhelm the new person who is overweight, even type 2 diabetic, or anywhere along that continuum of insulin resistance all the way to type 2 diabetes, what would you say to them to not overwhelm them are the best tools to at least experiment with in the beginning?
Yeah.
To help them start on this pathway.
Yeah. Yeah. And, like we talked about with the diet, going lower carb, going whole foods, going higher protein, and then stop snacking, right? That doesn't mean fasting or time restricted eating, but stop snacking. Like, it's so, on the one hand, sort of hilarious, and on the other hand, incredibly frustrating to think that we were teaching people for so long, you got to eat 6 meals a day, small frequent meals to keep your metabolism up. And like there's really not much science behind that, and that's not the healthy way to eat. But so many people believe snacking is perfectly innocuous and something important to do. But eliminate snacking first, and doing that by helping people feel fuller with their meals, by higher protein meals, whole foods, lower carb meals. So that's a great first step. And exercise is another perfect example, right? If someone feels like they need to go to the gym and pump iron 5 days a week, and that's what they have to do for exercise, a lot of them aren't going to start. It's just a non-starter. So in the beginning, just move your body, right? Everybody's got a smartphone now that tracks your steps. Whatever steps you're doing now, get 3,000 more. And then after that, get 3,000 more after that. And just make sure you're moving your body so you're not sitting. Then maybe eventually you can start talking about a more structured exercise program that has some resistance training, that has some dedicated cardio, maybe with some interval training. But if you start there, you're going to overwhelm people and lose a lot of people. So first, just start moving your body and then graduate to the exercise program. And sleep. I mean, we often don't talk about sleep nearly enough. Make sure you are in bed 8 hours a night. May not be asleep the whole time, but if you're only in bed 6 hours a night, you're really giving yourself a barrier to start with. And people think, sleep is the one thing that people can really blow off and think is not that important. Like, I don't need sleep. I do fine. Well, you may feel fine, but you don't know what's going on inside you when you're not sleeping well. And insulin resistance, chronic inflammation have been associated with poor sleep. And poor decision making. There was one study that actually I really liked. There was one group that was sleep deprived for, I think it was, I got to revisit this. I think it was 3 days versus one group that wasn't. And they took a like a cognitive test and reaction test, and they both felt like they did very well. Like when you asked them how they did, it was almost equivalent. But the sleep deprived group did terrible. They did not do well at all, but they felt they did just as well as the other group. And that, to me, that really shows how sleep deprivation and not getting adequate sleep can really sort of mess with our bodies and our brains.
I want to add a little bit to that snacking piece for people that feel like I couldn't go more than 2 hours without a snack. And you touched on this. When you start to change what you're putting in the body, that's going to become easier. If you're continuing to eat the junk food, the high carb, naturally you're going to be hungry every couple hours. That's only normal for that fuel going into the body. So it's hard probably for a lot of people to understand that until they try and increase the fat and the protein and then start to see the way their metabolism's changing.
Absolutely. Oatmeal with brown sugar and raisins, I guarantee you are hungry 2 hours later. No question. 4 eggs with cheese, avocado, and some vegetables, you're probably not hungry for 6 hours, right? Like it's It's a huge difference. So yeah, what you eat makes a very big difference.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. Metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance when your body